And before we get started, just thank you all for coming. And just a couple kind of basic rules we have throughout the Capitol during committee meetings. Please respect the time of the person speaking. It's their opportunity to speak. There will be no outbursts, no clapping. So please remain quiet in the audience. And committee members, once again, be respectful of the person presenting, and please keep your comments to questions more than statements, and we'll be able to roll through this very efficiently. So to begin with, ask Jenna from the Office of Revisers to do a quick overview of the bill. Thank you, Jenna.
Good afternoon, committee. Thank you, Mr. Chair. And we got a little bit of this briefing on Tuesday, but this will be the official briefing with the one in front of you. This is a bill brief on Senate Bill 363 as amended by the committee of the whole, as well as Senate committee. The Senate committee added new sections 1 and 2 to the bill, and that first section would require KDHE and KDADS to seek federal approval through a Section 1115 demonstration project waiver to establish continuous Medicaid eligibility for individuals with permanent intellectual or developmental disabilities, which we refer to as IDD, who are receiving those home and community-based services waived through the HCBS waiver. Section 2 was also added by the Senate committee and would require state agencies that administer assistance programs to report on the number of Kansans becoming ineligible for public assistance and why. This would require a quarterly report to the Bob Bethel Committee and the Legislative Budget Committees, and an annual report to the Senate Public Health, Senate Committee on Government Efficiency, House Social Services Budget, and the House Committee on Welfare Reform, this committee. New Section 3 requires the Secretary for Children and Families and the Secretary of Health and Environment to verify eligibility for food assistance and medical assistance programs by entering into data match agreements with state agencies to compare data related to individuals and households applying for food or medical assistance. The Secretary shall review and receive information concerning individuals or households applying for or enrolled in that assistance that may affect eligibility on a varying basis. The first one is monthly from Office of Vital Statistics related to death records, a quarterly basis from Department of Labor related to changes in employment or wages, every month related to changes in residency as identified by out-of-state EBT transfers, on a quarterly basis from Department of Revenue related to changes in income, wages, income, wages, or residency from tax records, on a monthly basis from Department of Corrections for incarceration status, semi-monthly from Department of Labor, including but not limited to changes in employment, assets, or income, and on a monthly basis related to the Kansas Lottery and Kansas Racing and Gaming Commission to identify households with lottery or gambling winnings of over $3,000. When an enrollee is determined to be non-compliant with requirements or ineligible for assistance, that enrollee shall be provided a 30-day notice prior to being disenrolled. New Section 4, this would be on page 4 of the bill, provides that on and after January 1, 2027, KDHE shall submit medical assistance enrollment data to CMS on a monthly basis and remove individuals enrolled in medical assistance programs in multiple states. Section 5 prohibits state agencies from providing an optional exemption. This would also be on page 4, geographic waiver or work requirements waiver for any public assistance program unless the legislature expressly consents to and approves of that waiver. Section 6 amends the big Medicaid, Medicare, or the big public assistance statute, KSA 39709. This committee is fairly familiar with, and it would adjust the threshold amount of lottery prizes triggering reporting from Department of Administration to DCF from $5,000 to $3,000, which would make it match with those changes in Section 3. It would prohibit DCF and KDHE from accepting self-attestation of income, residency, age, household composition, caretaker, relative status, or receipt of other coverage without verification prior to enrollment, increase the age of able-bodied adults without dependents, which we refer to as ABODs, through the age of 64, and require dependents to be under 14. Prohibit exemptions from time-limited food assistance for homeless individuals or individuals who are 24 or younger who aged out of foster care. Require that redetermination for medical assistance be done quarterly. Limit after January 1 retroactive enrollment, and require eligibility of an individual for medical assistance be verified against a master death file on a quarterly basis. And the bill would take effect on July 1. Upon publication of the statute book, it passed the Senate on a vote of 25 to 12. And I'll be happy to answer questions.
Thank you, committee. Any questions for Representative Sanders?
Thank you, Mr. Chairman. So going back to the end of Section 3, so an enrollee who is determined non-compliant is given a 30-day notice. Can they correct their non-compliance within that 30 days?
They should be able to, but I bet that one of the conferees will be able to give you more details on how that process works.
Thank you, Mr. Chair.
Any further questions for the advisors? Seeing none, thank you very much, Jenna. So we're going to move into the proponent testimony. I think we'll be able to work through this really efficiently, but it's 1:40 now. I'm going to allow about 15 minutes for the proponent, 20 minutes for neutral, and the remainder of the committee meeting for the opponent testimony. So we'll go ahead and open up the proponent portion of the hearing, and welcome to committee. Joining us, I think via WebEx, Scott Centorino, visiting fellow FGA Action. Welcome to committee.
Good afternoon, Mr. Chairman. Can you all hear me?
Yes, we can. Thank you.
Excellent. Well, thank you so much for the opportunity to testify. I'm Scott Centorino. I represent FGA Action from January of last year until a few weeks ago. I also served as a special assistant to the president for domestic policy, where I helped coordinate White House policy on welfare programs, including the negotiation and implementation of the Medicaid and food stamp provisions of the One Big Beautiful Bill. Whether you love the One Big Beautiful Bill or hate it, or love the president or hate him, or somewhere in between, these reforms are now law. And I think this bill before this committee is the right way for a state like Kansas to respond to it, with common sense, precision, and a commitment to protect these programs for the truly needy. And I encourage each member of the committee to support this bill. Before I go any further, I want to apologize. I have to be on video. I love traveling to state capitals, but I couldn't get to Topeka in time. I actually had to be in DC yesterday late, and I was actually in the White House talking about this bill. By now, I'm sure that you all understand the implications of, well, I'll call it OB3, creating financial incentives for states like Kansas to both restore program integrity to Medicaid and food stamps and bring those error rates down, and impose real costs if states fail to do so, that the accountability is shared. If Kansas doesn't fix this moving forward, to state the obvious, and bring its error rates down, it will mean less money for schools, less money for law enforcement, less money for roads, and everything else. But this is not a moment for fear. This is a moment of opportunity, an opportunity to do the vital work that this committee was created to do, to protect taxpayers and to protect this state's welfare programs for the truly needy that should have, frankly, been done years ago. Senate Bill 363 is the symbol and seizure of that opportunity, and it does three things that I'll highlight briefly, and then I'd be happy to take questions. First and most simply, this bill aligns the food stamp work requirement with recent changes in federal law and ensures that any waivers or exemptions of that work requirement have to come through this body, not to be decided by unilateral executive action. Second, the bill will reduce errors by implementing common sense data matching across state agencies. Records from the Department of Labor, Department of Revenue, Office of Vital Statistics, and so on will be cross-checked against welfare applications and records. And based on the department's testimony earlier this week that I had an opportunity to watch, it sounds like some of this simply codifies what they're already doing, which is great. And to the extent it expands accountability measures and brings in new data sets, all the better. Third, this bill addresses what, in my mind, is the primary vulnerability in Kansas's current process, and that's the practice of so-called self-attestation. I know the department mentioned it was starting to verify shelter costs and utility costs. They should be commended on that, and that their work should be codified into law, which this bill does. But all the basic factors for eligibility, income, residency, and household size and composition, should be checked and verified before enrollment, not just some. I also think it's telling that they expressed concern that checking more often would somehow increase errors, but they're willing to verify shelter and utility costs to try to bring the error rate down. Well, which is it? Household composition was talked about a lot in that hearing, and I think that's an area in particular that is ripe for fraud and waste. And I want to be really clear here because it can be confusing. The issue with household composition and self-attestation is not about differences between food stamp and Medicaid rules. It's about differences between what people put on applications and reality. And I'll give you an example. The Kansas Department of Revenue has records of married couples filing taxes that count one spouse's income in order to get refundable tax credits like the earned income tax credit or the child tax credit. And I guarantee you that some of those households have applied for Medicaid as single parents and do not report the spouse's income. Whether you call that fraud or not, it's wrong. It's unfair, it counts as an error, and it's entirely preventable with simple, rigorous verification and cross-checks. I know the department also raised the possibility that CMS might not let Kansas do some of this work to close the self-attestation loopholes. Well, first of all, other states have already banned self-attestation, including for household composition. States like Tennessee and Indiana. CMS is fine with it. Kansas should too. I know the department brought up other concerns about those two provisions, cross-checks and ending self-attestation too. And first, I know there's some concern about how burdensome the implementation might be. But I do have some good news. I noticed that even if their concerns about cost are taken at face value, the department didn't mention any offset in savings from these program integrity measures. And only looking at one side of the ledger does not paint a complete picture of this bill. If you're not accounting for any decreased enrollment among ineligible households and the savings that produces, they're not sharing the full picture with you. Most importantly, a number of states require what this bill does already. That's robust, regular data cross-checks. Louisiana, Idaho, Nebraska, Ohio, Kentucky, Arkansas, Florida, Texas, just to name a few, there are more. And the sky is not falling there. Moreover, states like Missouri, Montana, West Virginia, Louisiana, they all introduced legislation like this with fiscal notes of $0. No new monies, no new money, and no new employees. And more states are moving in this direction, not fewer. Indiana just last year passed a bill that banned self-attestation across the board. Income, residency, age, household composition, caretaker status, receipt of other coverage, just like this bill does. I obviously know that there are probably a lot of questions on this bill that I'd like to be helpful on, particularly given my experience at the federal level. All I'll say, and maybe this will come up again to close here, is a lot of the people who will be making these decisions have posters like this one behind me, and it's the Office of Promises Kept there, and they take that very, very seriously. So just a friendly heads up that some of the guidance that will be coming from the top, maybe not every bureaucrat down below, but some of the guidance from the top will be taking these rules very, very seriously. And I think I owe you all one more piece of information that may help correct the record from the hearing earlier this week before I close. There was a conversation in which the department mentioned a cause of errors in food stamps that they think is difficult to fix. They said that it's hard to change food stamp benefit amounts when enrollees are only required to notify them if their income changes, such that it makes them entirely ineligible. In other words, they said it's hard to avoid errors because people might get a small raise, but the employee or the enrollees are not asked to report that. What they didn't tell you in that hearing was that that is a policy choice that the department has made. Departments can choose either simplified reporting or change reporting. Your department has chosen simplified reporting. That's why nobody reports changes. That's the policy that your department has chosen. It's not some unstoppable cosmic force that they're powerless against. It is one of a number of policies, including self-attestation, that your department has affirmatively chosen that minimizes verification and maximizes errors. It's not just causing overpayments, it's causing underpayments. And we should care about that too. You all should know that, so I wanted to point that out. So I'll close just by saying that this bill is worthy of your support, not just because it will protect these programs fiscally. It's worth supporting because it will protect these programs morally. Your taxpayers are generous and they want to help the truly needy, but their patience with programs that waste their money on ineligible people is wearing thin. And that's what this bill does. It ensures that those who are actually eligible receive benefits and the right amount of benefits. It's that simple. So thank you very much for the opportunity. I'd be happy to answer any questions that any member of the committee has. Thank you, Mr. Chairman.
Thank you, committee. Any questions? So I'll start. So you mentioned, I think, Tennessee and Indiana have recently banned self-attestation, including household composition. I don't know if you're aware about the details of this, but there's concerns about how to check that. Because, how do you really dive into the details, aside from going out and knocking on a door, which we don't have the time to do. So any insight on how those states confirmed or double-checked the information they received?
Mr. Chairman, it's a great question. I'd be happy to answer it for you. States do it a variety of different ways. If you think about it in common sense, to prove who lives in your house with some kind of paper documentation would not be that difficult to show bills going to different members of the House. The one case where it might be more difficult, and I think this was mentioned in the previous hearing, is children. Obviously, you don't necessarily have quite as many records of children living in a house. But I mean, so I have a 3-year-old son. I have plenty of pieces of paper from his childcare, et cetera, that have his name and our address. The most common way that states do this, though, is it's cross checks with other data sets. So tax records, both federal and state tax records, are the most common way to check, because if you have a child, that's usually listed somewhere in your tax records for tax credit purposes. And so the other state databases, property records, et cetera, joint bank accounts, things like that, most people do not struggle to provide some documentation of who is living in the same property as them.
Thank you. Any questions? Representative Carr.
Thank you, Mr. Chair, and thank you for your presentation. As many of us can tell by the number of people in this room, this is a fairly serious issue with many people concerned. And with that, clearly facts are important. Can you tell me, sir, you provided a scenario whereby there was a married couple, and you stated that that you guaranteed that they were not reporting correctly. Can you provide us with a data or source for that information?
Mr. Chairman, yes, of course. I'd be happy to tell you that based on my own experience as an assistant attorney general in a state working on some of these issues, I've seen cases like that. And in every state that does cross checks, they find cases like that. So I don't know what the number is in Kansas. I don't know that anybody knows. And that's probably part of the problem, that these cross checks aren't happening. But I can almost guarantee you that there are plenty of cases like that.
So problematic. So what you're saying is that you can't provide us with any hard data that substantiates your statement, and therefore we're basically talking about an opinion.
Mr. Chair, I would disagree with that characterization of my answer. I've seen them. I've seen cases like that. Not an opinion.
Thank you, Mr. Chair.
Representative
I've seen the
Meyer.
Easter Bunny as well.
So, Representative Meyer.
Thank you, Mr. Chair. Thank you for being here too. So I have a couple questions. I will try to keep them brief, though, I promise. And thank you again for allowing me to sub on the committee today. So one of my questions, you've used this phrase repeatedly, and the individual who I've seen speak in front of this committee has previously too, who do you mean by the truly needy?
Primarily, I would say the folks who are eligible for the program. These programs are designed to serve a certain population, and it's their eligibility rules, as you know, based on income and assets and other eligibility factors. So for the most part, these programs are designed to serve a limited population of folks who, as shorthand, we'll call the truly needy, people who are, for reason of circumstances, disability or income or otherwise, some combination of factors, are actually dependent on these programs to survive. And that's how these programs are written to serve those populations. There are other individuals who sometimes gain access to these programs, as I'm sure you know, that are not eligible for them. And I would say that unless I mean, we can have a debate about whether the program should be expanded or not, but in terms of who is actually eligible for them already, I think we should probably all agree that only folks who are eligible for the program should be on them. That's who I would, in shorthand, call the truly needy.
That's interesting because our eligibility process already screens them into that pretty effectively. I know we haven't met before, but I'm a social worker and I've been working in the field for quite some time, and also myself have been a recipient of SNAP, Medicaid, and child care assistance. So I am very familiar with how the system works and who the truly needy, quote unquote, are. But I think that would be a mischaracterization of the way that our eligibility process works and how difficult it already is to get benefits in Kansas. But thank you for answering that. Mr. Chair, if I may, I have one more question.
Yes, please defer your time more to questions and statements so we can work through everybody. Thank you.
Thank you, Mr. Chair. So this is about, and I'm not sure that you touched on this, but this is about the quarterly Medicaid redeterminations. So that seems like it would be a pretty big issue for us here in Kansas. It also might make us fall out of compliance with CMS. And we do not currently have expanded Medicaid, so it doesn't appear as though we would even need to be completing those quarterly checks. And according to the testimony we heard from KDHE just the other day, this would make it very cost prohibitive and could actually impact the state by millions of dollars. So could you tell me why it is that you believe that Kansas, who is not a Medicaid expansion state and therefore is not required by the big beautiful bill to do that, should be doing that? Thank you.
It's a great question. I think that obviously the more verification that you can do without causing problems, the better, in short. And I think that part of the purpose is you've got folks who are on the program that are still able-bodied adults, even if Kansas is not an expansion state. That's folks particularly in the parent caretaker category, as you know. And I think the more robust verification processes you can implement, the better, because that way you can reduce the chances of having an error rate that will put you out of compliance with that 3% threshold in Medicaid.
Representative Weichel.
Thank you, Mr. Chairman. My question actually follows really closely with the previous question from Representative Myers. So you stated in your testimony that these provisions were included in the One Big Beautiful Bill, and so for some reason we now need to put them in state law also. But a lot of the Medicaid provisions here actually were not included in the One Big Beautiful Bill. As I listened to the debate on that bill last year, which I did quite extensively, Congress went out of their way to only target the Medicaid expansion population. And in their debate, they considered all non-expansion populations what I would consider, they refer to them as the truly needy, which is the same language you use. So to follow up on that, why do you guys think that we need to go so much farther than the One Big Beautiful Bill did when the populations this is targeting in Kansas is exactly the populations that Congress decided not to target with that bill?
Yeah, it's a great question. Two different things are happening, and if I misspoke, I apologize. There are parts of this bill that are alignment with federal law. So, for example, the food stamp work requirement provisions in this bill are aligning Kansas policy with the provisions in the One Big Beautiful Bill. There are other provisions of this bill that are trying to meet a target that are put out in OB3. So in OB3, it creates that threshold of the 3%, as you know, where the state will be on the hook for the additional error rate and improper payments that go above that. The federal government, I'll be honest with you, I wish it weren't this way. The federal government is not that invested in how you all get there in terms of the error rate. They're happy to let you all either exceed or come underneath that error rate. and they'll be happy to send you the bill if you exceed that error rate. They don't care. They've got 49 other states to worry about, and most of them are bigger than Kansas. And it's up to you all to figure out how you stay under that threshold. That's why I encourage the members of this committee to support this bill, because this is a really smart way for you all to stay under that threshold, is by going through these program integrity measures, data cross checks, verification, ending self-attestation. So you're right. There are measures in this bill that are in more detail than OB3, because OB3 just puts in that threshold. It doesn't tell you how to get there. You all could say, we're not going to do anything. We'll just pay the difference. But especially since the last time your error rate in Medicaid was only measured during COVID, when the rules were very different. The last time your state's error rate in Medicaid was measured using the rules that you all are going to be judged by in the future, the error rate was closer to 20%, not 1 or 2 or 3%. That's hundreds of millions of dollars potentially. And so I think this bill does a pretty good job of making sure that your department is doing everything it possibly can to bring that error rate down and keep it down. That's not spelled out in OB3, and I think this bill does the good work of spelling it out, how you're going to get there.
Thank you, Mr. Chairman, for the follow-up. I mean, I think the good news is that we heard testimony on Tuesday that our Medicaid error rate is now below 1%. So it seems like all of our current policies and procedures that are in place are doing exactly what you're trying to do here. And we also heard that, and I know from experiences in other states, that the more paperwork you add, the more bureaucracy and red tape you add, you're actually likely to increase your error rate in many ways. And so it seems like the most prudent decision here would be to maintain what we have, because our error rate has dropped below 1%. And I apologize for not having a question, but thank you, Mr. Chairman.
I'd be happy to respond if you'd like. But
Yeah, quick response, then we'll move on to what will probably be one of the last questions here. I think we have a couple more questions, but yeah, please respond. Thank you.
sure, I would just point out that 1% error rate was conducted, and it was during COVID, and all the rules were different, and a bunch of errors were not counted in that time. The error rate you're going to be facing is going to be in double digits. And if your department hasn't explained that to you all, shame on them. And I will say also that if you all are not considering things like this, you're in for a rude awakening, I'm afraid.
Okay. Representative Helwig.
Thank you, Mr. Chair. Just real quick, we talk about the extended checks and multiple checks that we'll be doing. There's quite a fiscal note with this. Can you explain, can you address that fiscal note that's attached to this bill?
It's a great question. I honestly can't. My best guess is looking at it that it's based on only one side of the ledger. Even so, there are a lot of states that have implemented cross checks like this at no cost and no new employees. My guess is that they're not incorporating any potential savings into that fiscal note, and I'm not sure why they would. If you're removing ineligible households from these programs, your administrative costs will go down, and I'm not sure why that wouldn't be counted, to be honest.
Thank you. And just one more kind of question. It's on section 1 of the bill with the waiver for those with permanent disabilities. Do you see any problem with the federal government allowing that waiver or anything like that?
It's a good question. Obviously, I don't speak for them anymore. I think that they sent out a letter that I'm sure your committee is familiar with, and you are, sir, back in July of 2025, indicating a skepticism against continuous eligibility waivers under Section 1115. I would be a little worried about that, if I'm honest with you, that will not be approved, but I don't know. I can't speak to it definitively.
We have 2 more questions. Representative Humphreys.
My question, I think, is just maybe for the chairman. But so the fiscal note that we're looking at, is that the one from KDHE? It's not like the regular Department of Administration kind of fiscal note that we get for other bills. Do we have that too? Okay, maybe it's on the S drive. So I was just curious if this was a fiscal note we're talking about that's on the KDHE testimony, or if we have a fiscal note from the budget director or administration.
It is on this drive, and also on the legislative website, there's an official fiscal note.
Okay, I haven't had a chance to take a look at that one. Is it similar to this one, or is it different? Okay, that's fine. You don't have to.
If you can check into that Oh, yeah, Jenna will check in. And
Okay.
when she has that.
Okay, thank you.
Representative Roser?
Thank you, Mr. Chair, and thank you, Mr. Santorino, for providing your proponent testimony. I have a question for you. You're going to have to forgive me because I am a Republican, so I'm about the numbers. If this bill costs more to administer than it saves in fraud prevention, would FGA Action still support it?
It's a good question. I don't believe the premise is accurate, of course. You may not be surprised that I would push back on the premise, of course. I've not seen a scenario where it wouldn't pay for itself based on decreased enrollment among ineligible households. I think in principle, depending on the cost, I think we're all okay, for example, spending money on a police force, even in a town without much crime. People care about safety. People care about law enforcement presence. People want laws to be upheld. They want things to work in their community. The same principle applies here. People, I think, can and are willing to spend a little bit of money to make sure that these programs work and are only serving the folks who are actually eligible for them. So in principle, sort of an abstract concept, I'd be comfortable spending a little bit of money to make sure that a much, much bigger pot of taxpayer dollars are being spent only on the folks that are eligible for the programs. But again, I would probably reject the premise because program integrity has a funny way of paying for itself for obvious reasons.
Well, thank you very much, committee. Mr. Santorino, thank you for joining us today. And we're going to close the proponent portion of the hearing and move on to the neutral testimony. And welcome to committee Dr. Whiteside Hicks, Director of Economic and Employment Services, Kansas Department for Children and Families. Welcome to committee, Doctor.
Thank you. Did I do that? I did. Thank you. Thank you for the opportunity to be here this afternoon. Just want to, a few things that I want to reiterate, and we've spent a lot of time talking about household composition. I did take that question back to my team. We have been talking about how we could verify household composition, and there truly is no easy answer to that. And one of the things that I thought about during a conversation was that I have adult children who use my mailing address as their permanent mailing address. They do not live with me. So their mail comes to my house. So if you're saying, whoever gets mail at that address, those are the people who live there, that is not always the case. So it is a difficult verification for us to be able to provide. So I know that you've already seen the numbers in terms of the additional staff that we need. I believe someone asked previously what our current vacancy rate is. It is about 15% among our eligibility workers. And also for the sample that we pull, that we are required to pull for our federal quality control case reads, that sample represents 0.1% of our caseload. So 0.1% of the cases are pulled to be read every month, and we are basing our payment error rate on the reads for that 0.1%. So I also want to make sure that I am addressing that. As I mentioned before, we are in a new federal fiscal year. We have read the first month of the new federal fiscal year, and our payment error rate for that one was 6.13%. And what we're doing for verifications to directly relate to that, because I do know that there would be an additional cost to the state, we have implemented a verification of shelter cost. I know I've mentioned that before, but I want to be clear that we are calling that an experiment. And it's an experiment because we made that change. What we have seen right now in requiring verification of shelter cost instead of self-attestation, obviously we have an increased workload because now someone applies for SNAP, they say they live here, now they have to prove that they live here, so we have to pin to their case, allow them 10 days to respond, then the rental agreement comes in, and then someone has to physically pick that up and take case action on that. So we have increased our workload, and what we're looking at right now is determining after we implemented that policy back in October, do our numbers show, as we are reviewing our case reads, are we seeing fewer errors specifically related to verification of shelter cost? Because if we do, then we know that, yes, that's a verification that we need to keep doing. If not, maybe we don't do that and we try something else. So one thing that I appreciate is having the flexibility to determine whether or not a strategy actually addresses the issue that we are intending for it to address. As we've talked about before, many of the verifications that are in this bill, we are already doing. I cannot stress enough, we do not accept self-attestation for income. We have always verified that. Residency, we verify in multiple ways. It could be your driver's license. It could be your paycheck stub. It could be when we run your Social Security number through the Social Security Administration database, which also is how we would verify your date of birth. If you are receiving Social Security benefits, there's an address that is on that screen. And so we can verify that way. And if there's a discrepancy between the address that Social Security Administration has for you and what you are claiming on your food assistance application, that falls into the category of prudent person. And we would ask some additional questions to verify where that individual is actually living. The staffing impact is the last comment that I will make. We have talked about that. So currently we have about 60 vacancies across the state with our eligibility workers. It does take a solid 12 months to train them to be able to do their jobs. So adding staff, yes, we would have to do that to be able to keep up with these additional verifications. The previous speaker also mentioned our simplified reporting. Yes, we do have simplified reporting to make sure that we are not putting an undue burden on those who are applying for benefits, those who are eligible to receive these benefits. That is the reason we have the simplified reporting process. And without that, if we become change reporters as a state, that does mean every single change, 3-4 times a month that a household reports, we have to take case action. That will put us in the position of backlog, which means we will be out of compliance with federal law. We will be financially sanctioned because we will not be able to make benefit determinations within 30 days. And with that, I will stand for questions.
Thank you, Doctor. Committee, any questions? Representative Humphreys.
It's just a super quick question. I think maybe a typo. I think on your testimony it says opponent, but is it neutral? I mean, you're in the neutral section, but
I didn't even see that.
it's on the front. It's just on the first page right here.
Okay.
Yep.
I would have to check with our legislative liaison.
Okay. Yep. Thank you. Thank you, Mr. Chair.
Representative Meyer.
Thank you, Mr. Chair, and thank you, Dr. Whiteside Hicks, for being here again. So when I was going over your testimony over the last few days, I kind of was wondering, so in my experience when helping individuals apply for these benefits, typically they will apply for more than one program at once because they're likely eligible for multiple programs. This is kind of a two-part question, but I'll just ask them both. Can you tell me approximately what percentage of applicants typically will apply for multiple programs, so like SNAP Child Care Assistance and TANF at once, and then during that process of applying, even though some of the programs are eligible for self-attestation because other programs are not, would they not also be providing all of the elements like income, residency, age, et cetera?
Yes, thank you for that question. For the number of applicants that we have who apply for multiple programs, I would have to get back with you for that data. Yes, we are looking across programs. So for example, if I apply for SNAP and for TANF, there's a school attendance or school enrollment requirement for TANF. So I have to verify that my children are enrolled in school. I have to provide verification that my children are enrolled in school before I can have my TANF case approved. Well, if I'm showing that my children are enrolled in a school that is near where I say I live, we're going to assume that I really do live in the state of Kansas and I really do live where I said that I live.
Representative Helwig.
Thank you, Mr. Chair. So this bill is going to put more checks in there, and you said your error rate is down to 6.13, which is great. On their error rate, though, is that from overpayment, underpayment, and what percentage of which?
It's from both, and I would have to pull the data to tell you which, but it is both overpayment and underpayment.
But is it typically overpayment or underpayment?
No, I do not have that data, but we can get that.
Representative Roser?
Thank you, Mr. Chair. Just two really short, quick questions. The existing program, does that run on a quarterly renewal deadline process, or is it annual?
For SNAP? For SNAP, once you are approved for SNAP, for most households, you have an interim report that you're required to complete and submit at the 6-month mark, and then you have a recertification at 12 months.
Okay, under the existing process, if somebody misses the deadline because of illness or unstable housing, mail delays, how quickly can they regain coverage?
Once they reapply. So we will close your case if you do not submit your interim report, and we send your interim report, then per federal policy, we have to then send you a reminder if you did not submit the report, then we send you a closure notice that says your benefits are going to end at the end of this month. Then the applicant can come back in and provide the information that we need, and we can reopen the case that day.
Thank you, Doctor. Thank you, Mr. Chair.
Representative Weichel?
Thank you, Mr. Chairman, and thank you for being back here today. It sounds like DCF has done a good job bringing down the error rate so far with the flexibilities you have. Do you feel like you need anything in this bill to help you continue to bring down that error rate?
I do not. I appreciate the flexibility. As I've said, when we're making a decision for a policy change or a process change, every decision is based on research that we have done. We're going to reach out to other states who have done the same thing that we are considering doing to see what that impact had on their caseload, on their error rate, on their clients. And then, again, once we implement, we are constantly monitoring. And if it's not working, then we stop and we implement a different strategy that would be intended to meet our needs.
Last question, then we're going to move on. So Representative Sanders?
Thank you, Mr. Chairman. So you heard the previous conferee say that the error rate is going to be more like 20%. I'd like you to address that. Where do you think he's getting that number?
Sorry, Doctor. I think that was for Medicaid. He was, but if you want to defer till our next, to Christine, feel free to.
Yes, I would defer. I do not know.
With that, thank you, Doctor, very much, and appreciate it. And also thank you for the efforts. I know you presented Tuesday some of the additional checks you're doing to reduce the error rate on SNAP. Appreciate that. Good luck with that. I think you're going to do great. Next, we have Christine Osterlin, Deputy Secretary for Aging, Integration, and Medicaid Director, Kansas Department of Health and Environment. Welcome to committee.
Good afternoon, Chairman, members of the committee. Christine Osterlin. I'm not going to cover all the information that we covered on Tuesday, but I will hit a couple points from the testimony. So there was a reference to the over 19% error rate from 2019. Absolutely correct. As I stated before in front of committees, the reason for that error rate, the bulk of the errors was when we were in the clearinghouse backlog. And any case that you approve that is over the 45-day timeliness is an error. And those are considered underpayments because you should have provided more days of coverage than you did. But that error rate was attributed to the backlog at the clearinghouse. So that is why when we talk about increasing workload or having to send additional notices which add a minimum of 12 days to case processing timeliness, we have to have the right balance. Definitely understand, concerns around program integrity, not saying that that's not important, it is, but we have to balance it with there is significant financial risk to the state if we start going over that 45-day timeline and create a backlog, because as the previous speaker alluded to, in H.R. 1, there would be significant penalties to the state if we were untimely. The other thing that I will mention, and the other conferee mentioned this as well, that we do have concerns around the language in the bill around the continuous eligibility for home and community-based services members. It is not that we wouldn't want to provide them continuous eligibility. It is due to the July letter that we received from CMS saying that they would not entertain those 1115 waivers. I have in my testimony a lot of details. It takes 1 to 3 years to develop a waiver application under the 1115 umbrella. Some other waivers, they're not as extensive, but we're concerned about the amount of state resources that would have to be invested in order to create and submit that application when we have current guidance from CMS that says it would not be approved. So that is our reason. It's not that we don't want to provide continuous eligibility. It's looking at it from a resource side and saying, should we invest state staff time and resources into undertaking an activity that at the end of the day would not be approved. I think those are really the only additional comments I wanted to point out from my testimony that we didn't get to on Tuesday, and with that, I will stand for questions.
All right, thank you. And we're trying to keep the limited questions. We have time for everybody at the end of the meeting, but Representative Weichel.
Thank you, Mr. Chairman, and thank you for being back today. So just to clarify, because the sole proponent of this legislation stated that we need the Medicaid provisions in this bill in order to bring down that error rate that was approaching 20%, but you are saying we've already brought that down under 1% because we're out of the backlog without any of the provisions in this bill. Is that right?
Yes, we are out of the backlog, so that obviously reduced the error rate. But I do want to state that we had, after the 2019 PERM, we had 2022 PERM. Our error rate at that point was right under 7%. So because of the backlog being cleared, it went from 19 down to 7. I would disagree with the representation that COVID somehow had a big impact on PERM error rates. But we'll save that for another day. But since then, we brought it from 7% down to less than 8%, just by activities that we've been doing. You know, we're not always standing still. We're like, you know, Dr. Whiteside Hicks. We're always looking for ways to improve, implementing new policies, talking to other states, finding out what they're doing. And so now we've reduced our error rate from 7 to below 1%. Do I think we'll stay below 1%? I think it's a very tall standard when you're dealing with about 300 human beings who process eligibility. You know, less than 1% error rate is really pretty impressive. You know, we'll do our best to stay as close to that as we can and definitely below 3%. But yes, the more times you have humans touching cases, there is a risk that your error rate would go the wrong direction.
Thank you, Mr. Chairman. So I have the same question for you that I asked Dr. Whiteside Hicks then. Do you feel like you need anything in this bill in order to keep the error rate where it needs to be to avoid penalties from CMS?
I would, to be honest, I don't know what we could do, because the more times we're touching a case, the more opportunity for error. That's really, you know, just the concern. If there are things that we could identify that would solely be data, but the challenge in Medicaid is we cannot take a negative action on a case due to a data match. So anytime you get something that indicates they may not be eligible, it requires a worker to touch that case. And there's just always concern that the more times you're touching a case, again, these are human beings, and you are going to increase your opportunities for error.
Representative Humphreys.
Thank you, Mr. Chair. I'm a little confused about your fiscal impact on the front page. So are you, you know, there's no dates or like it was this and now it's this, and I know, anyway, so could you explain it just a little bit?
Yeah, so our fiscal, most of it is related to staffing. So we're estimating we need additional about 20 FTEs. The reason for that is, as looking at the bill language as it is now, the amended bill, our original fiscal was higher, but there were amendments done in the Senate that significantly reduced our fiscal. We anticipate right now there will be about 40,000 individuals, 40 to 45, that every quarter would be subject to the redetermination language that is in here. So that means that's about 40,000 cases that we're going to have to touch on top of our current workload. And so really it is math. It's about 15 minutes to work a data match once you get the verification in. So it really is taking the amount of cases over our production standard to come up with the 20 FTEs.
But I'm not understanding the amounts. I understand 20 full-time employees.
Oh, that's based on our...
Where are you getting this, you know, 2.393 all funds?
Yeah, so the staffing below it, the 880,000, that is based on our current salary for our eligibility workers. They make just a little over $20 an hour for an eligibility trainee. There would also be supervisors because we have to have a certain ratio. So I can give you the breakdown of all the salaries. We have 4 levels of eligibility workers, and each of them have a different salary level, but I'm happy to share that with you so you can see. And I can break down for you how many in each category.
I don't need that detail. Okay, so I understand the 880,000 divided by 20 new people, that's 44,000 average salary. That's fine.
And benefits, yeah.
But what is the one up above it?
That does include the FTEs, and if you go to the next page, we also have in there a data fiscal impact, and then below that we have the system impact, fiscal impact. So the 2.3 is all of those added together, the cost for the system changes, the data, and then our 20 FTEs. So that's what makes up that total 2.3. I think it's 2.39 if my memory is correct. Yes.
Okay, and the system, the system changes, not the data, but the system changes. That's like 1 point, more or less 5 million, you're saying?
Yes.
Okay. Okay, thank you for that. That's helpful. It's a little confusing. Thank you, Mr. Chair.
Last question, Representative Burkamp.
Thank you, Mr. Chair. Thanks for the testimony. So the first proponent indicated that how they measure Medicaid error rates is going to change. Are we taking that into account, or can you comment on it? Is your 1% using that, or is there going to be a different measurement standard going forward?
No, there's not going to be different measurements going forward. So like I said, I would disagree on how they characterized how perm audits were done under COVID, and the fact that making the link between COVID flexibilities to reducing your error rate, that would just be a fundamental disagreement. But we have done a lot of work within eligibility to reduce our error rates, and our numbers reflect that.
Okay, thank you.
Well, thank you for coming to committee. And committee, do take your time to read through KDH&E's testimony. They did a nice job going through every part of the bill and then adding comments, especially in reference to some of the federal laws. All right, we'll close the neutral portion of the hearing and move on to the opponent portion of the hearing. Apologize, it's always hard to stay on task. Got 35 more minutes, maybe be able to go a few minutes late. So right now, I think I have 14 people wanting to speak. And so we're going to try to put a little bit of a time limit and hold questions till the end. So unless somebody wants to offer their time to another person, we're going to limit to 2 minutes. So we'll start with Mr. Sean Gatewood, Co-Administrator, CanCare Advocates Network. Welcome to committee.
Thank you, Mr. Chairman, members of the committee. I'll try to keep somewhat brief today. I want to kind of go through my concern with this bill as the CanCare Advocates Network, and I should explain who they are. They're a group of all of the sort of people and organizations that are served by the CanCare program. So we try to bring folks together that represent kids, people with disabilities, all sort of together to speak with one voice. And right now we're here to oppose this bill for a variety of reasons. We also agree that program integrity is of the utmost importance. My issue with this bill is the CanCare program is a relatively skinny Medicaid program as it stands today. So we need to probably talk about the populations that the CanCare program serves, and just to gain a fuller understanding of the impact, particularly around the self-attestation and the quarterly reporting. So the biggest thing that CanCare, the biggest population in the Medicaid program is children. The Senate took kids out because that serves kids all the way up to 400% of federal poverty. And I want to say that's like 60% of the enrollment in the Medicaid program. The next thing where the money is at for the Medicaid program is long-term services and supports, people with disabilities. So there are home and community-based services waivers that are in the Medicaid program, and that is to support people living in their home that qualify for an institutional level of care. Those waivers, the Senate committee took out. Many of the people that are in nursing homes today, the housing section of that paid for by the Medicaid program, Senate took that out. Everybody over the age of 65. Who did it leave in? Well, for one, people with mental illness, there is no waiver for mental illness in the Kansas Medicaid program. There are a lot of folks there's Social Security, disability, SSI, SSDI. They are still in the program. There are custodial parents, and when I say custodial parents, that means they have custody of their children, but they meet the income eligibility guideline of under 38% of federal poverty. So family of three, single mom, 2 kids, that's making under $200 a week. And somehow they're keeping going. So when we talk about the fiscal note and we go through these different populations, yes, it did not include when we, if you put out a hurdle, somebody's going to trip, right? You're going to have people come out of the program. I think that to some degree that's some of the idea, but we haven't seen evidence of that much eligibility fraud in the program. And those things are going to manifest themselves because those are the populations we have. So those are going to manifest themselves beyond the savings that's there in the fiscal note. You're going to see that pop up with dissolution of the family unit, kids coming up in foster care because parents aren't taking care of their mental health disorder, their addictions, or whatever else. People with mental health disorders, severe and persistent mental illness, that all coming up. And I will stand for questions at the appropriate time. Thank you, Mr. Chairman.
Thank you. Next, we have, I think, Kyler Kessler, but I have a note here that Michelle Ponce is going to speak for Mr. Kessler. All right, very good. Thanks. Welcome to committee.
Thank you for allowing me to sub in for Kyle. Chair Auerkamp and members of the committee, my name is Michelle Ponce, and I am the Associate Director for the Association of Community Mental Health Centers of Kansas. We represent all 25 of the community mental health centers across the state who serve all individuals regardless of ability to pay, making them the safety net for Kansans with mental health needs. We appreciate the opportunity to provide testimony today. As written, we have significant concerns with this bill, particularly the requirement for the quarterly redetermination. Individuals served by our mental health centers are often experiencing crisis, struggling to maintain symptoms of persistent mental illness, or in need of support to maintain recovery. For these individuals, that quarterly redetermination is a burdensome requirement to navigate that lengthy Medicaid application every few months. We believe that could lead to a significant number of individuals losing coverage, not because they don't qualify, but simply due to clerical errors. We also know that when individuals do not have health insurance, they delay seeking the care that they need, often leading them to be in higher need and in crisis, becoming more ill and needing more services. Such frequent redetermination also increases the odds of those simple clerical errors, whether it's on the side of the beneficiary or the state who is processing the applications. This application also removes the current allowance for residency or household composition without independent verification prior to enrollment. While at face value, that might seem like a simple proposition, but many individuals struggling with mental illness may also experience instability in housing, making that verification more difficult and challenging, putting them again at risk for losing their coverage, not because they're not eligible, but simply because they weren't able to meet these requirements. Thank you for the opportunity to provide this testimony, and I will also stand for questions at the appropriate time.
All right. Thank you. Sorry for mispronouncing your name, Ponce. All right. Very good. Next, we have Amy Campbell, Kansas Mental Health Coalition. Amy, welcome to committee.
Thank you, Mr. Chairman. Amy Campbell, I work for the Kansas Mental Health Coalition. My testimony looks like this. In particular, I want to talk about some of the challenges of Senate Bill 363. First of all, the federal rules that were passed in H.R. 1 will go into effect in Kansas whether you pass this bill or not. It is an unfortunate truth that a large percentage of the folks who are accessing mental health treatment or crisis interventions are already uninsured. We do not want to push more people with serious mental illness into the uninsured population, because that is where, guess how they get paid for? There's no federal match for the state hospital beds, for the crisis services, for the things that you are doing for folks who are uninsured. That's why you see a line item in the budget every year for uninsured supplemental funds. Jumping ahead, processing these eligibility, the eligibility processes, they use fax machines. You know that it can take months if all of the documentation doesn't get there exactly on that date. We have folks out there who have faxed the information a couple of times and are still being told that they don't have it. I can provide you with people who work on the ground who can talk about these situations. The organizations like your medical clinics, your hospitals, mental health centers, FQHCs, and centers for independent living will attempt to help people access their eligibility and get them hooked up with services, but they don't get paid to do that. So that's an unreimbursed service that happens, and it's a burden on providers in order to do that. Most folks aren't going to know they've lost their service until they show up to the appointment, and when the clinician puts it in, suddenly it comes up they're ineligible. Now they find that you're going to get into that eligibility churn. The Senate added some very good language to exempt folks under waivers. Please note there is no waiver for adults with mental illness. Therefore, they are targeted by this bill. There are many reasons that this legislation is unwise, but simply focusing on those redetermination standards should point out that this bill is not well thought out and that the folks who drafted it don't do this work on a day-to-day basis. Thank you, Mr. Chairman.
You're welcome. Thanks for being here. Next, we have April Holman, Executive Director, Alliance for Healthy Kansas.
Thank you, Mr. Chairman. And yes, that was right. Thank you, Mr. Chairman and members of the committee. I have written testimony that you should have before you to describe what our position is more in depth, but I want to just hit a few things in my short time that I have. Basically, we are most concerned about the quarterly redetermination and to some extent as well, the ban against self-attestation. For both of these things, we're concerned about the additional hoops that people will need to jump through in order to get coverage and keep their coverage. And we know that increased paperwork does very little to decrease fraud, but it's been shown to significantly impact the ability of participants to retain coverage. Quarterly checks means 4 times as many chances to lose coverage, even if participants still qualify. The Senate removed several groups from the quarterly redetermination requirement, but it did not eliminate the issue for thousands of Kansans with mental and physical illnesses and disabilities. There is no population of individuals participating in Medicaid in Kansas that is equipped to meet the burden of quarterly redetermination. Lawmakers should fully understand the impact of the changes proposed in Senate Bill 363 prior to enacting this legislation. This could be accomplished by an interim study or even extended hearings on the bill. The pace of the legislation so far has not allowed for in-depth study of the issue and has required instead amendment after amendment to fix unintended consequences with multiple issues still left unaddressed. For these reasons and other negative impacts on programs impacting the social determinants of health in Kansas, I respectfully request your opposition. Thank you.
Thank you very much. And next we have Ashley Beeson, Harvesters Community Food Network. Welcome to committee.
I'm actually filling in for Ashley Beeson. My name is Elizabeth Keever. I'm the Chief Resource Officer at Harvesters, and I'm here on behalf of Harvesters, the Kansas Food Bank Second Harvest, and collectively we serve all 105 counties across Kansas. And we're here today in opposition to Senate Bill 363 because this bill goes far beyond simply aligning with federal law. It introduces costly bureaucratic and unnecessary changes that ultimately cause low-income Kansans to lose access to food and healthcare and ultimately increase our error rate. It increases state spending without improving outcomes. And it does nothing to help connect more eligible Kansans with food and healthcare. And so many eligible Kansans are already struggling. Your constituents every single day are struggling. Housing prices are up. Over the past 5 years, we have seen a 30% increase in the cost of food. And right now, families are trying to squeeze in the increased cost of gasoline. And this morning, I don't know if any of you all read the Washington Post, there was an article that showed that in their reporting, they found that 1 in 3 Americans were skipping meals and basic necessities to afford health care. 1 in 3 Americans. And we know that families every single day would run into terrible choices that they have to make when they lose their SNAP benefits. Last fall, we saw during the government shutdown what it means to lose your SNAP benefits. I'll never forget the phone call that I got from one of our neighbors right here in Topeka. She called me crying because she was in line at one of our mobile distributions and asked me what she should do. She was at risk of missing her shift at work if she got out of the line to receive food. She was balancing keeping her job and feeding her family. That's what it means for so many people. And by increasing the error rate, by putting the program at risk and having people lose their benefits to help them get by, it means a lot for our families. And we encourage you to oppose Senate Bill 363. And I'll stand for questions whenever is necessary. Thank you.
Thank you. Next, we have Reverend Dr. Annie Ricker, pastor Shawnee Heights and Barrington Methodist Churches. Welcome to committee.
Hello, thank you. Yes, I'm Reverend Dr. Annie Ricker. I'm a United Methodist pastor in the Topeka area, and I'm also the board chair for Kansas Interfaith Action. It is clear throughout Scripture that we have a moral imperative to care for our neighbors experiencing poverty and hunger. But often those mandates are treated as spiritual exercises for individuals or for local churches. But when Jesus addresses the disciples in Matthew 25, separating those who cared for their neighbors and those who didn't, Jesus isn't making an argument for personal responsibility. The word Jesus uses is nations. Jesus is telling his followers that it is their nations, their governments, their communities as a whole that will be held to account for the way that they choose to care for the most vulnerable in their midst. If error rates are the primary concern, I guarantee the majority of Kansans would choose to err on the side of feeding a few more than on letting our truly needy neighbors starve. Creating extra hurdles, onerous eligibility requirements, and unnecessary red tape before our neighbors can receive access to food or health care is immoral and unchristian. Nowhere in the Bible does Jesus judge the poor for the food that they choose or the kind of job that they have. But over and over, Jesus judges those in power for creating the structural conditions that lead to poverty, sickness, and hunger. That is exactly what SB 363 will do, all while costing taxpayers more to do less good. And that is why I implore you to oppose this shameful bill. Which side will we stand on, Kansas? Let us truly love our neighbors and vote no on SB 363. Thank you.
We have Haley Kotler, Senior Campaign Director at Appleseed Center for Law and Justice. Welcome to committee.
Thank you. Good afternoon, Chair Auerkamp and members of the committee. My name is Haley Kotler, and I'm testifying today on behalf of Kansas Appleseed. My life right now illustrates something important about the policies that you're considering today. Decisions like these proposed in SB 363 land in the middle of Kansans' complicated lives. Some on the committee may know that my mom is a quadriplegic and relies on full ventilation support. She lives alone not because it's the safest option, but it's what she can afford without state support. My grandma is 97 and recently moved into assisted living after living independently for years, in large part because of the help that I provided her. This week, she's in the hospital, and I'm traveling back and forth from Wichita and Topeka. But I'm lucky to have an employer that is flexible and understanding of my situation. I say lucky because that's exactly what it is. It's just luck. But even with that luck, I spend my days coordinating care, managing medications, meals, paperwork, and rearranging my life when something falls through. And let me tell you, something always falls through. Just last night, my mom's other caretaker was sick, and I had to step in. There I was writing this testimony and feeding my mom. I'm an educated professional who understands how these systems work. And even I know that one difficult week could cause something critical in my family's care to slip through the cracks. A phone call, a piece of mail, a deadline missed. Many Kansans are also quietly holding together fragile, complex systems of care for their own families. Policies like these proposed in SB 363 work best when life fits in neat categories. My family doesn't fit in those categories. I can assume that some of your families don't fit in those neat categories as well, and many other Kansans won't as well. I believe that SNAP, dang, I had that time, Chairman. Thank you.
Thanks, Haley. All right, Heather Braun, Senior Policy Advisor, Kansas Action for Children. Welcome to committee.
Chair Avercamp and members of the committee, good afternoon. I'm Heather Braun, Senior Policy Advisor with Kansas Action for Children. While the Senate improved the bill slightly, this bill still creates far too many hurdles for populations eligible for public assistance programs, including requiring Medicaid quarterly redeterminations for our lowest income parents or caretakers of children and those with disabilities who are not on an HCBS waiver or waiver waiting lists. While supporters argue that federal H.R. 1 allowed for more frequent redeterminations for all Medicaid populations than current practice, a March 6th letter to state Medicaid directors from CMS makes clear that the more frequent checks allowed by H.R. 1 every 6 months are only to apply to the Medicaid expansion population in Medicaid expansion states. Kansas is not a Medicaid expansion state. As a result of this guidance, we strongly urge this committee to remove the entire quarterly redetermination section on page 22 of the bill. Our written testimony includes several other reasons for why we oppose Senate Bill 363, but I want to offer an alternative path forward. We know that those receiving public assistance already encounter and trip over hurdles when applying for and renewing their benefits. The tiniest of mistakes, including those out of their control, can result in the loss of benefits. Instead of this bill, we recommend the legislature instead takes the time to understand what parents of children, pregnant women, people with disabilities, and the elderly encounter when navigating existing Medicaid and SNAP application and renewal processes. Our end goal should be that ensuring our lowest income populations, the working poor, and the vulnerable remain eligible for public assistance, not make these programs more difficult to access. The conversation will take time, energy, and patience, and we stand ready to participate in a larger conversation to improve and streamline public assistance application and eligibility systems. That's where we should spend our time, not this bill. Thank you for the opportunity to speak, and I'll stand for questions at the appropriate time.
Thank you. And next we have Carla Hagemeister.
Hagemeister. There you go. Good job.
Welcome to committee.
Good afternoon. My name is Carla Hagemeister. I am the Executive Director at Flint Hills Breadbasket. We are a food security program located in Riley County. We serve Riley County, Fort Riley, and part of Potawatomi County. For the purposes of my testimony today, my experience and my world is much more centered around food assistance, so I will keep my comments mostly directed towards SNAP, that portion of the bill. I appreciate the opportunity to testify. I appreciate also the ability to watch and observe the hearings that have been happening, both in this chamber and in the Senate. I testified prior in the Senate in reference to this. I've watched the floor debate on a Friday night because I'm that kind of nerd, and watched this testimony, this hearing on Tuesday. I appreciated the information from Dr. Whiteside Hicks and from Ms. Osterland. It was informative and helpful in thinking about what I wanted to share. My first thought when I think about policy is, what is the intent of this policy? Is the intent of this policy to reduce the error rate? We know from prior hearings and from the testimony that DCF has made considerable progress towards achieving an error rate under 6%. They're on the right track. Is the purpose and the intent to codify the one big beautiful bill? We know that DCF and Medicaid are already required to comply with federal law and program regulations from the federal government. The language in Senate Bill 363 as it stands today could place one or both of those agencies out of adherence with existing law by requiring more frequent processing and verification. Does it, as written today, comply with federal law, and is it necessary? Is it intended to reduce waste, fraud, and abuse? We learned from previous hearing that the error rate is driven by changes in circumstances, not by an inability by our agencies to identify potential abuse? Or is it intended to increase fiscal responsibility to ensure that our public dollars are spent responsibly? And I would say that, again, our agencies are on the right track. I appreciate this opportunity. Thank you.
Thank you very much. Next, we have Carrie Rinker, American Heart Association. Carrie, welcome to committee.
Thank you, Chair. I am a region government relations lead for the American Heart Association, and you do have our written submission in front of you. But many of the policy points that I would make would just be repetitive to what you've already heard. So I, too, am just going to bring to you a more personal side of this policy. In 2015, my 16-year-old was a healthy honor roll student, active in band and choir. After a simple car accident and concussion, he developed severe ongoing symptoms that left him completely homebound. He was ultimately diagnosed at Mayo Clinic with hyperadrenergic postural orthostatic tachycardia syndrome. That's a mouthful. We call it hyper-POTS for short. Research published in the American Heart Association's journal Circulation shows that the physical and mental health impacts for POTS patients can be comparable to that of people with congestive heart failure. Treatment is complex. My child sees multiple specialists, has frequent medical appointments. Like many young people with chronic illness, he wants independence. He has relied on supports funded by our tax dollars, my tax dollars, SSI, food assistance, Medicaid. Thankfully, the safety net worked as intended. He has slowly taken college courses and now is entering the social work field, as occupation we sorely need more of here in the state of Kansas. He starts his first job in April, a day that I truly never thought that I would see. It's a flexible job. His employer understands he'll need more sick days, and yet they hired him because he is worth it, most certainly. Under SB 363, my child would not qualify for these exemptions. He does not meet narrow disability definitions. He isn't on a PD waiver and would face repeated paperwork just to keep food and health care coverage. Even as a health advocate with a master's degree, I found this paperwork overwhelming. Late notices, complex questions, complex deadlines. I struggled. I recall trying to find a fax machine one time while on vacation. I also want to recognize that these programs worked as intended. He has reached a place of self-sufficiency. He now has a chance to contribute to the overall betterment of Kansas, and I am so proud, and Kansas should be proud too. I ask you to keep families and caregivers facing cardiovascular and other chronic complex diseases in mind as you consider your vote on SB 363. Thank you.
Thank you. Next, we have Leroy Burton, Kansas Silver-Haired Legislature. Leroy, welcome to committee.
Thank you, Chairman. Thank you, committee members. I represent the Senior-Haired Legislature. We represent over 700,000 seniors here in Kansas, and 85% of those live below the poverty level. That's a staggering number when you begin to look at something like that. 25,000 Kansas seniors participate in the SNAP program. So the programs are very necessary for those people. I'm not going to go repeat a lot that's been said here, but I'm going to talk about some items that are important to us as seniors in the state of Kansas. We feel that the senior concerns that we have here that will create paperwork barriers that eligible seniors will lose coverage. SB 363 prohibits agencies from accepting basic self-reported information, requiring additional verification and documentation. Seniors would be required to submit full documentations every 3 months instead of annually, increasing the likelihood that eligible Kansans lose coverage due to paperwork barriers, not loss of eligibility. Speaking as a senior, I'm fairly adept with a computer, but there's a lot that's not. And you go 3 times a year that they've got to get on the computer and make a notification to come back in, we're going to lose some people. We're going to lose a lot of people. And that's just senior citizens, because we've got the disability for the adults and everything, and some of the others, the young kids too. increase in cost of bureaucracy without improving the outcomes. Verification requires more staff, more processing, more systems, and more taxpayer dollars spent on paperwork instead of services, reducing efficiency without improving the program integrity. I've been reading and been talking to some people here. You know, this particular bill is probably the most comprehensive bill that's out there and been presented to the state so far. If we pass, or you pass this bill, you will be the first one to pass this comprehensive bill. And we as seniors believe sometimes being first is not the best. Okay? On behalf of the Senior-Haired Legislature and 700,000 seniors, I urge you to oppose Senate Bill 363. Thank you.
Thank you, Mr. Burton. Next, we have Sarah Prem, American Lung Association. Sarah, welcome to committee.
This opportunity. With the American Lung Association, we represent more than 400,000 Kansans living with lung disease, and we work to ensure eligible Kansans have access to adequate, affordable, and continuous health care coverage. We oppose SB 363 because it would put CanCare coverage at risk for eligible Kansans and create significant administrative burdens for the patients and the state. 363 would require CanCare eligibility to be re-verified every 90 days, as several people have mentioned. This added red tape could cause eligible people to lose coverage, not because they no longer qualify, but because they would miss paperwork or deadlines. For patients with serious lung disease, coverage disruptions can be very dangerous. Delays in cancer treatment reduce survival chances, and gaps in care for people with COPD can lead to severe flare-ups and permanent lung damage. The bill would also increase the cost for the state, as we also heard. More frequent eligibility checks mean more churn. People losing coverage, reapplying, and being reinstated, which costs the system hundreds of dollars per person and diverts resources away from patient care. CanCare works best when coverage is stable and continuous. SB 363 moves Kansas in the opposite direction. For these reasons, the American Lung Association respectfully urges you to oppose Senate Bill 363. Thank you.
Thank you. Next, we have Mike Burgess, Disability Rights Center of Kansas. Welcome to committee, Mike.
Thank you, Mr. Chair. And as the chair said, I'm Mike Burgess with the Disability Rights Center of Kansas. We too oppose Senate Bill 363. I think a lot of great things have been said so far, so I'll try and focus in on a couple of key things. And I think, as it was said before, I mean, there absolutely are people with disabilities who would be impacted by this bill as drafted. And so one of our big concerns is around that quarterly redetermination process as well. Just because if you think about individuals with mental illness, you know, paperwork 4 times a year, I mean, you're going to find people who still very much qualify, but because of bureaucratic reasons are removed. And that obviously, as other people, you know, would be a terrible outcome. Also, I want you to think about the face of this. As you've heard some of the agencies talk about, every time something comes in that impacts them, well, then they have a phone call and a voicemail and then a return phone call. And then, oh, I need to track down this piece of paper and then find a fax machine to send it. I mean, like, it becomes a huge barrier, simple just tracking down one piece of paper that they may not have. So just keep that in mind, who we're talking about as you're looking at this, because I think that's an important thing. At the Disability Rights Center, those of you who've worked with us, I mean, we like to work towards solutions. So I want to come and offer, I think there are opportunities for process improvements. We've seen this before where the legislature has helped convene task forces to come back with reports and recommendations and do a deep dive into some of these processes. I think those opportunities are absolutely here, and I think we can do better. I don't think 363 is the answer, but I think bringing together state agencies, other stakeholders, people with disabilities, legislators, and others, you know, we can make a difference, and we can improve this, and we can make it work better and get better outcomes. So that's my uplifting, positive piece as we're talking. And with that, Mr. Chair, I'd be happy to stand for questions at the appropriate time.
And last here, I think, did she already speak? Elizabeth Keever with Harvesters? Yeah, you already spoke. All right, very good. So committee, open up for questions. Are there any questions? Any of the opponent testimony? Representative Roser.
Thank you, Mr. Chair. I have a question for Ms. Carla Hagemeister. Committee, I want to welcome Ms. Carla Hagemeister. She is a constituent and lives in Riley County in Manhattan, Kansas. I wanted to ask, prior to committee, you and I had discussed maybe you had like a handout or something. Did you bring that with you?
I do. I have copies of it with me. It was in the digital file as well, but I do have hard copies.
I would like to request that from you if possible, and I'd be willing to hand it to out to the committee.
I would love to. Thank you so much.
Thank you.
Representative Meyer.
Thank you, Mr. Chair. I'm not really sure who to ask because there were so many great speakers. But this one is really about what Kansans already experience when they are applying for SNAP, for example, or Medicaid or TANF or anything like that. Could anyone walk us through the process? I'm very familiar with it personally, but I think it would be helpful for the committee to understand how laborious and involved this process could be. Sure. Thank you.
I'd be happy to. That actually is relevant to what I brought. The people that are profiled in the handout are SNAP recipients that receive services through their breadbasket in Manhattan. And one of the previous, one of the previous testimonies, there was a discussion about the unseen labor or the uncounted labor. And I think that's very true. Programs like the breadbasket and other programs throughout the state offer SNAP assistance or application assistance as a service because we understand that it is a challenge for many of our guests, our clients, the people that that receive services from us. And I'd like to maybe just highlight a positive on this one. The first person described in that brochure, I helped apply for SNAP. He lives in Manhattan. He's lived in Manhattan 30 years or more. It's a familiar face to all of us. We all know him. He came to us through the help of his employer who realized that he was not getting by. He had about $9 left in his bank account at the end of the month, and it was not a good environment for him, a good situation for him. But he had lived in the same residence for more than 10 years, had the same job for more than 10 years, very stable. However, in reality, working with him, because he came into us, I helped him fill out the application. He provided all the information with the assistance of his employer, who printed the copies of the information that was needed, the pay stubs. She made sure that he had his lease agreement. She made sure that he had the copy of his identification, all of those pieces. I then was able to scan that information with the equipment we have in our office, and I was able to submit it on a Thursday afternoon. In reality, with much respect to this gentleman, my hunch is that he probably has either an undiagnosed developmental disability or some educational deficits in regards to what his true literacy level was. I don't know that he could have done this on his own. He clearly hadn't been able to do it on his own prior to our reaching out to do that help. So we completed the application. We completed online. The paper application is about 32 pages long. Includes income, all sorts of information that you could complete. We did that. I did that for him. To the beautiful part of it, within 24 hours, I had a phone call on his behalf because I was helping him. I was able to complete the interview and do the verification. It was great. The worker from DCF said, XYZ question. I provided the information. She said, please hold while I plug this information into my verification. And I listened to their delightful music, and then she came back on and said, okay, great, let's go to the next piece. Let's go to the next piece. Let's go to the next piece. We completed that, and he was verified and completed and approved within 24 hours, and that was amazing and wonderful. I don't believe that this gentleman could manage to do this on his own repeatedly through this process. He is a hard worker. He is working the hours that are required. He is doing all the right things. But the added impact of having to do this process multiple times a year would absolutely turn him into not somebody who is receiving fraudulent services or not ineligible for services, but perhaps he would have become disenrolled in the program because he could no longer cross that barrier. That maybe we would save money as a state in not having to provide those services to him or those dollars to him, not because he doesn't need them and not because he's ineligible for them, but because he couldn't dot the I's, cross the T's to make sure that he was getting re-verified with that level of frequency. And I think that's a pretty common experience for those of us that are helping people through that SNAP application process.
I really appreciate that testimony, and I also want to say that I was going to ask you how long the paper SNAP application is, or the paper benefits application is. A couple years ago when I was serving on this committee on a regular basis, I brought them in, and they are about 32 to 36 pages long. But on that note, you were talking about how it's possible he could lose his benefits. How many individuals in your community are there available to help individuals who, with that high level of need? So if we had people who were very much like your friend that you're talking about, which is a very common occurrence in my work experience too, do you have enough people in your community to fill that role as far as workforce or volunteer even?
In practical experience, we are fortunate to have a DCF office in Manhattan. There's also a DCF office in Junction City. In both of those offices, during times of high need or high usage, we will absolutely refer people to physically walk in. If you need assistance, physically walk in and wait for somebody. And in reality, a person could wait all day for assistance from a DCF worker. And that's not because anybody's being rude or insulting to them, but simply because of the workload that they have. So the programs that are available to help people with SNAP applications or other applications are coming from other agencies that are nonprofits or other providers of other types of services that realize that there's the common goal of making sure that people have the access to the resources. The breadbasket, I would say, is probably the strongest one in Manhattan in regards to doing SNAP support.
Yeah, and I think the reason why I asked that is because, beyond what is actually going on with the expense to the state, which looks to be over $10 million, there's an unspoken amount that nonprofits and other organizations seem to be like they would have to spend, right?
Yes, that's
significant impact on your organizations, you would say?
I would say, and I would also just say by nature of example, we are probably helping at least one person a week with a SNAP application. And we're a mid-sized population community. Thank you.
So if you got a few more questions, but committee, I know we're past the 3 o'clock hour. Feel free if you got meetings you have to go to, just feel free to leave as you need, and we'll keep going until there's 7 members or no question. So Representative Roser.
Thank you, Mr. Chair. My question's for Carla again. Just a question for the Red Basket, because I feel like I should know this. Data recorded by Flint Hills Breadbasket, do you record data on how many of your recipients that come through your building are military affiliated, like veterans or? Okay.
And actually, that's going to be true of most food programs in the state right now, because Feeding America provides free software that harvesters, it all trickles down. So Feeding America has provided software that all harvesters partners and all Food Bank of Kansas partners are now utilizing, called Neighbor Intake. And that data system allows us to track how often people are visiting, whether they have did they attend basic? Did they attend basic and served? Did they attend basic but not served? Did they never serve in the military? We're able to I can identify right now how many people live on Fort Riley or are active duty military, and that was very relevant during the shutdown. So yes, we can gather a very broad scope of information across the state of Kansas now.
Really quickly, thank you, Mr. Chair. This might be a question for Ms. Elizabeth Keever, but either one of you could answer. If this bill exempted military and seniors being defined as what's currently in statute, roughly what percentage of the breadbasket recipients would that exclude?
I might defer to Elizabeth, because I don't know that I'm tracking what you're asking.
Sorry, I can clarify. Roughly what percentage of people that you have coming to the breadbasket are military related or seniors?
I'd have to pull that, and I can for you, but I think the other piece of it that's relevant that I can tell you off the top of my head is of the people that we serve at the breadbasket, somewhere between 19 and 21% receive SNAP benefits. So even when you look at who is receiving services from food programs across the state, it is not majority. The majority of our folks that are receiving services do not have the support of SNAP. It is folks who are either ineligible for SNAP for one reason or another, but the vast population that we serve are actually not even participating in SNAP, and we wish they would be.
Thank you.
Please, if you can, no, please, just state your name for.
Oh, sorry, Elizabeth Keever with Harvesters. Between 2021 and 2023, about 7,000 Kansas veterans received SNAP benefits. So it's roughly around 25% of all veterans experience some level of food insecurity. And then when it comes to who receives SNAP benefits, largely the vast majority are seniors and children. So when you look at kind of what the average recipient is, that's around the rate. And all in all, when you look at the totality of all that we serve, about 19% of the folks that we serve on an every single day basis even participate in the SNAP program. So that's kind of some context too.
Thank you, committee. Any further questions? Representative Sanders.
Thank you, Mr. Chair. For any of the opponents, I heard several of you mention fax machines. Does the bill require the use of a fax machine?
Amy Campbell, Kansas Mental Health Coalition. I referred to fax machines to point out that it is a cumbersome, slow, it's not a slick digital process that some people think that it is. I have recently been told that our state eligibility program is moving away from fax machines entirely, which is good news if that's happening. But I can also tell you that our CanCare program, healthcare information that's shared with the managed care organizations is done through fax. So I think that sometimes when we look at legislation, it looks like, great, match the data, it's all gonna automatically cross-populate, it's gonna be great, it's slick, it's easy. It's not. That's not the reality.
But in this bill, can you use email in lieu of fax machines?
You will use whatever process the eligibility office is using. You as an applicant don't get to decide what's the easiest way for you to send that information. The eligibility system, and the Deputy Secretary is here, she can tell us what we're using now, will tell the applicant what they need to do and how they need to provide that.
And they don't allow emails?
I think that you will find there are some emails. I don't know how much flexibility there is in how they're receiving that information today.
Thank you, Mr. Chair.
Any further questions? Seeing none, we'll close the opponent portion of the hearing. And that concludes our work for today. We do have a meeting next Tuesday. Have a great weekend.